Everyone, thank you very much, Secretary Ghaly. So I will get us started with today's numbers. So as of today, we have 2,235 new cases, and our 7-day average is 3,474. And the total number of tests average is 121,981, and our 14-day positivity is 2.6%. So wanted to talk a little bit today, as Secretary Ghaly mentioned, the high holy days are coming up, and we know this is a time when people want to celebrate the new year and bring in Rosh Hashanah and Yom Kippur. And they do start Friday evening, and we want to remind people that many or most synagogues are offering online services, and the safest activity remains Zoom services at home and observing the holy days with those you live with. If you do gather, it's best to do so outdoors at a distance of 6 feet and while wearing masks or face coverings. We do specifically advise against sharing communal or self-serve foods. And again, we know this is a very important time, but we cannot let our guard down. And we know a lot of holidays are coming up, and this is a time that people want to be together, but really focus on those who you live with and stay virtually connected. And with that, I will turn it over to Secretary Ghaly to go over our blueprint.
Thank you, Dr. Pan. Again, you're becoming familiar now with the blueprint. This is our third week with a new approach to creating our safer economy across the state. I want to begin by just thanking the many folks who've been engaging with us, whether it's on the business sector side, but really so many people at the county level, whether it's our elected supervisors, mayors, health leaders, and other leaders within counties that are really listening and hearing the activities in their own backyards and sharing them with us at the state so we can really move forward as a state. We know that there is a great deal of interest in how we continue our safe, steady movement. And I'll just remind you that the entire backbone to the blueprint for a safer economy is this notion of being slow and stringent, that we want to make sure as we move forward in the face of flu season coming, winter, colder weather, maybe some rain, that we really do bring down our transmission, our test positivity, the number of cases that counties are looking into as part of their contact tracing and disease investigation strategies, and we really do reduce those as much as possible so that the lower levels we achieve, the more room we have to see as things move during these critical times. And we want to make sure that our hospital systems are not just able to take on individuals with COVID-related disease, but all of the flu that we might anticipate, other common symptoms of colds, pneumonias, and to make sure that we don't have to defer much needed care again. Just by way of reminder that every county is assigned a tier. I'm going to go through that in just a moment. Every Tuesday, looking at data on every Monday that is about a period of 2 weeks behind. We assign a tier based on both test positivity over a 7-day average and an adjusted case rate. We are also continuing to work on our equity measure. We're working very closely with a number of stakeholders, both at the county level and other people with both expertise around closing disparities and addressing health equity across our state and across the nation, to make sure really what is a nation-leading concept around having a health equity measure, that we do it in such a way that really helps us focus on addressing the inequities that disproportionate impact on certain communities, in particular Latinos, Blacks in California, who have shouldered an undue burden of COVID-19, both in the number of cases, but also in hospitalizations and death. And so we continue to be committed, and as we work through it, we will update all of you and make sure that the public understands how we're working closely with your counties to close those gaps. So again, by way of reminder, we have 4 tiers: purple, red, orange, yellow. That's widespread transmission, substantial transmission, moderate, and minimal. The two metrics we track are new cases per day over 100,000 people population, and then test positivity. And you can see on this slide the different thresholds for each of the various risk levels or tiers. So summary of where we are this week, I'll remind you on August 31st, the first time we announced this with the same criteria and thresholds you saw on the last slide, 38 of our counties ended up in purple, that's the widespread. Red, orange, and yellow were 9 counties and 2 counties respectively. Today, 2 weeks, this is really our second update to that August 31st. On September 15th, we now have had 8 counties move out of purple into red, and we don't yet have any counties that have moved from red into orange or orange into yellow. And the reason is, remember, our requirement was that a county must remain in a tier for at least 3 weeks. So next week will be the first week where counties can move from red to orange or orange to yellow. So we anticipate that there'll be some movement among some counties in those tiers, and we look forward to updating you about that next week. So this week, 3 counties, Inyo, Marin, and Tehama, all moved from purple, that's the widespread tier, to red. And that's because they were in purple initially to start, and we always allowed the purple counties in the purple tier to move as soon as they met criteria for the red tier 2 consecutive weeks. So these 3 counties met that requirement. They've met the thresholds for red tier for 2 consecutive weeks, and for that reason they're moving. We know there's a whole host, another set of counties that are in purple today who have met the criteria for the red tier for 1 week. So if those trends hold and they continue to see stable and reduced transmission, both in their case rate numbers as well as test positivity, that some additional counties could move from purple to red next week. Again, this highlights, and we're happy to see the sort of fruits of the labor in this strategy, that counties do move as we see stable, steady reductions in transmission. And our hope is to continue to work with counties as they move through the tiering system to make sure that all preventative measures, that the contact tracing and the testing is adequate so that we avoid any counties moving backwards, that is from a less restrictive tier to a more restrictive tier. So before we go to reported questions, I just want to remind you, and we usually have this slide here, where I have a chance to remind you of the importance of wearing your mask, maintaining that physical distance, that's 6 feet, that we try to keep things outside, that we, if you're sick, that we encourage you to stay home, consider getting tested if you're having the classic COVID symptoms. And as I remind my young kids, but we all need this reminder, to wash your hands frequently so that we can reduce transmission, not just of COVID, but other airborne communicable infections. And in anticipation of flu, these are important messages that we'll continue to drive home. And with that, I want to turn it to the first reporter question. Thank you.
Paul Rogers, San Jose Mercury News.
Thanks, Dr. Ghaly. Halloween is now 6 weeks away. Stores are selling costumes for kids. What's the latest outlook in terms of your recommendations to families? Should kids be trick-or-treating this year? And if so, under what guidelines or conditions?
Yeah, we're continuing to work. Thank you for the question. And again, it is increasing in frequency, this conversation at my household, as I'm sure many of you with young kids or grandchildren are anticipating. Or you might wonder, should I pick up a couple of bags of candy because I'm going to anticipate, like I do every year, trick-or-treaters at the door. We're really urging people to be prepared for a different type of Halloween. As I said last week, you know, trick-or-treating, the type of mixing that comes in our traditional trick-or-treating festivities is really not advised under COVID. We're going to be working to put out some guidelines that are clear about how we can still celebrate the Halloween festivities, even enjoy in some of the traditions of candy and sharing that kids really look forward to. Really encouraging my own kids. Were asking, can I start planning my costume? We really want to make them this year. I encourage them to do all of those things because that's part of the buildup and the fun and the excitement around Halloween. So even if those few hours of trick-or-treating and the mixing that comes look different, we think some of the preparation can look very much the same, and I'm certainly looking forward to it, and we're going to provide clear guidance. I know some counties are already putting some guidance out there, helping their communities think about it, and we're working with our local partners to ensure we put something out at the state that can be statewide and really meets that moment of where we are with transmission. But I think in all things are pointing to quite a different Halloween. And just as we talk about the High Holy Days being different, each of these upcoming celebrations are going to look different over the course of the rest of this year, certainly, and into early next year.
Amy Taxon, AP.
Thank you so much. San Diego County was the first large county to move out of the purple tier. But while the state figures are falling, San Diego's numbers are up and now would place it into the purple tier. What is happening there? And do you think the increases are the result of more businesses reopening?
Yeah, I mean, great question. And we've been in close contact with San Diego specifically, not just their health officers, but some of the elected supervisors in San Diego County, really trying to dig in and understand what might be attributed to some rise in cases. We know that they have San Diego State University has had a number of confirmed positive cases, very few hospitalizations, thank God, but a number of confirmed hospitalizations. So these are going to be ongoing conversations to understand where a county is. San Diego is a large county. They've done quite a bit to really be prepared with both understanding where transmission is happening across their community, being prepared with testing and contact tracing, and we are working with them closely to understand what this impact might be. We don't take it lightly, as I said. We want to be slow in the forward movement so we can have some certainty and make sure that any decision to move a county into a more restrictive tier is done thoughtfully with a lot of deliberation to ensure that we don't cause businesses or communities to feel sort of stuck in the middle, going back and forth between having some level of operations and then bringing that back down. So our commitment is to work with San Diego and any other county that is starting to see some increase in their numbers. We don't yet have enough evidence that it can be attributed to the businesses that have already begun to increase their operations in San Diego, although we're closely looking at that, and that's where the disease investigation and the contact tracing work, which San Diego is doing an excellent job on, is really useful. So this will be a busy week with San Diego in conversations about how we plan moving forward. And really all of our hope is that we can put steps in place that help support San Diego County, their own work to reduce transmission and get us back on that track that they were enjoying a few weeks back.
Brody Levesque, Los Angeles Blade.
Now dumping a lot of toxins near the observatory of Mount Wilson. We have fires all up and down the coast that are causing problems. We have displacement now of folks all over the place because of these fires. We also have the ongoing situation with COVID-19. My question to you and also to your colleague is, what steps is the state of California taking to assist the local counties and the county health officers as they're dealing with an increase in respiratory ailments, problems with people breathing because of the smoke, and then COVID over the top of that? This just seems to be compounding problems. I know, for example, in Los Angeles, the air quality index again is off the scales today. We got warnings from the county on that. And it just seems to me that there should also be kind of a little bit more of a push or a focus on, COVID is still around. We still have a problem. This isn't helping. What else can we do?
Yeah, Brody, I missed the initial part of your question, but I think I captured the gist, and I appreciate the question. This is really, and we were remiss not to really highlight in our opening comments, both Dr. Pan and I, the real nature of what we've seen. Now, we mentioned it last week. It's not just COVID, it's wildfires, it's air quality, it's a number of different challenges, occasionally some communities having to have the potential of a power shutoff to avoid the fires. So all of these things compounding together, as well as the long-term stress of just living in a different new normal for very many months. We recognize that all of those things together requires a focused response. We've been in close contact with county health officials and others who are in areas where the impact of the fires has compounded things in a significant way, really looking at the influence of smoke-related drivers to hospitalizations and emergency room utilization, and really working to understand how we can be more prepared for not just surge around COVID, but surge around even the need for care with wildfires. So there has been some specific reach out, understanding how we work through the hospital community that really came together in a wonderful way in California as it related to COVID, but now taking on this additional challenge. There's also a lot of work across all of state government, whether that's with the Cal EPA or Natural Resources Agency, to ensure that our response isn't just a public health one, but it's an all of government conversation with our local partners to make sure that individuals potentially facing an additional hardship have the resources that they need. We understand things like guidance around which mask to use in which setting is important. We've done a lot to work with the evacuees to make sure that the old norm of a congregate shelter where hundreds of people might come together to spend a few nights in a gymnasium eating buffet style food, that's really transitioned to nearly 90% of the individuals who are sheltered are now in hotel rooms with themselves or just their close family, so that we can reduce the potential risk of COVID while still meeting the demand and need for shelter when people are evacuated. So I think there's been a very focused approach on trying to work together to ensure we deliver the services that we can to those individuals facing many, many different hardships all at the same time.
Andrea Borbeck, KPIX.
Hi, Dr. Ghaly. Thank you for your time. As we look at positivity rates going down statewide, even in large outbreak areas like we've seen in Merced County in recent weeks, what gives you pause as we move into fall and winter? What is keeping you up at night? Is it the possibility of flu season? Is it concerning about increased hospitalizations from flu and pneumonia in addition to COVID? What are you most worried about as we head into the future here?
Yeah, I think it's those two things, and thank you for the question. I will say, as we move forward in this response, we have learned so much over the many months, and two of the things that we've seen really improve our transmission rates isn't just the when we do things, but it's really about the how. And if there's anything that keeps me up at night, or among the most important things, it's really how do we continue to deliver the message that these face coverings, these cloth face masks, make a major impact on transmission. We see it more and more. The medical literature comes out every week with another important review of these not only protect those around us, but they cause us to have added protection and reduce transmission. So how do we continue after many, many months of sending the same message without having counties and people or people fatigue around some of these simple to follow, but not always fun to follow guidelines that help us keep transmission down? So wearing your face covering, making sure that really takes into account some of the things that we've talked about here, the outdoors, the short in duration, the physically distanced 6 feet apart, not sharing different items, and wearing your face covering as much as possible. All of those things, I believe that if we do them, and we do them in a high, in a sort of in a high percentage way, that we can really move into the coming other challenges, whether it's flu, other respiratory illnesses, the colder weather, that we'll be able to actually keep and maintain and even accelerate some of the gains that we've seen over the last many months. I will say I'm very encouraged and happy to see the improvements in these numbers in the Central Valley. They're still relatively high, but they've come down quite a bit. And even in big counties like Los Angeles and many of the Bay Area counties, I think we've seen this continued trend, which reminds me every day that we do have the tools to continue to win this war against COVID. And it's really up to us, 40 million strong, to keep putting it into practice every day.
Patrick Healy, NBC Los Angeles.
Hi, thank you very much, Doctor. I'm wondering if you could talk a little bit more about the San Diego situation. If the numbers continue the way they are, is San Diego on course to have to drop back to the purple category? And if I could compound the question, if that is the scenario, do we have to look at LA County more carefully in the coming weeks as its incidence rate is dropping? LA would appear to be en route to qualify for moving up a tier. And compound it one more step, how will this new equity metric affect the calculation for Los Angeles? Thank you.
Yeah, thank you for all the questions. I'll just go in order. For San Diego, the whole construct here was move slow and with confidence around some stringent guidelines so that we can avoid moving back. But we know that some conditions in counties cause increased transmission. We'll see more cases. But we also want to make sure that we're taking some of the context of communities into account. So this will be an ongoing conversation with San Diego. All that said, if collectively there's a real belief that slowing things down, putting things on a pause, even moving to a more restrictive tier is going to help us get through the coming months, the state is certainly prepared to do that and in conversation with the counties. That was the whole premise of our construct, and we believe that it is going to be the one that carries us through. We don't know when, but certainly as we see the ups and downs of transmission, we should expect a county to potentially be moved to a more restrictive tier at some point in this entire experience. We're working hard with San Diego to figure out how we can support and look at the numbers so that we make that decision in the wisest way we possibly can, with both the public health of the San Diego community in mind, but also the broader, in the broadest way, not just COVID health, but the broad economic health. As it relates to Los Angeles County, indeed, their transmission rates are coming down. I think it comes on the backs of a lot of really hard work from a number of people in the Los Angeles community, where we've seen increased testing, a focus on disproportionately impacted communities, and an ability to begin doing more and more of the contact tracing and disease investigation. All of that comes together along with the driving home these messages around face coverings and physically distancing and reducing mixing, so that we can support LA County and frankly all of the counties to not just move forward if that's where the numbers lie, but also to focus on the sectors, but schools additionally. And I know that I would be remiss not to mention our collective and galvanized focus to work with our local school districts, the health officers that support those school districts, to ensure that we're paying attention closely to when it might be lower risk for kids to return to in-person education, wherein we're focusing on not just student health, but teacher and staff health altogether. As it relates to the equity measure, we are still in active conversations understanding how the equity measure, as it's implemented, will impact our tier assignments. I think there's been a lot of really rich conversation with a number of stakeholders so that when we do come out with that equity measure, it's one that we know supports our overall vision of promoting equity across California, not just in health, but in all areas, that we're looking closely at the disproportionate impact, particularly on Latinos and Black Californians, so that as all of our counties move forward, we don't leave any of our communities behind. And that's the purpose of the equity measure, and we're working hard to get that in place so that it can really be a proud California moment as we look forward, and frankly, at the end, as we look back at our response to this pandemic.
Angela Hart, Kaiser Health News.
Hey, Secretary Ghaly. It's virtually impossible to find an N95 mask right now as a regular person, not an essential worker or a healthcare worker. And I just wanted to ask you if the N95 challenge, how the N95 supply issues are impacting the state, and if the state's doing anything to get these masks out to the broader public, given the wildfire threat, given the social distancing needs, the urging to do things outdoors. It's increasingly difficult as we head into a really tough flu season. I just wonder if the state is doing anything more on the PPE front, and if the state has had, what kind of challenges the state's seeing in terms of PPE distribution.
Yeah, thanks, Angela, for the question. Very timely. We continue early on. I think everybody tracked that we California, like most states, really had a challenge finding the personal protective equipment, including masks, N95 surgical masks, were clear off everyone's shelf. You couldn't find one almost anywhere in the nation. We were reaching out to many of our global partners to identify supply chain for these masks. The governor, under his leadership, working closely with Cal OES and a number of other partners, really did work to put in place California's own ability to get N95 masks, other surgical masks from a number of different vendors, and then really distribute those not just to our healthcare providers and hospitals, but our skilled nursing facilities, our adult residential facilities, many of the essential workers. And that concept does continue today. There's still a focus on getting different face coverings and masks out to individuals who are working outdoors, whether that's in agricultural fields or other outdoor industries, especially in the face of wildfires. So that pushes on. We are continuing to look as we enter flu season, and we see some of the federal stockpile challenges that could emerge, that we put in place plans so that California can continue to be fairly self-sufficient, have the supply chains there. I think critically speaking, and Angela, I'll use your question as a point of reminder, that during the wildfire season, where we know that many people can't be outdoors, especially if they don't have the right mask to be outdoors safely from poor air quality, that we encourage people to stay home, be indoors. Hopefully you have the power to have your air condition on if that's what's needed because it's hot in your communities. But that even though we recommend most activities, especially if you're gathering, happen outdoor, we encourage you during this hard time to stay inside where the air is fresher, cleaner, and the risk for COVID with your immediate family is pretty low, that we continue to deliver that message. All of that is to say we are certainly preparing for what could be a challenging time with making sure we have all of the supplies for personal protective equipment and other supplies, but we've learned a lot over the last many months, and we have the tools to ensure that Californians have what they need to get through the next many months.
Adam Rokusen, ABC San Diego.
Yeah, hi, Dr. Ghaly. Business owners are telling us they're worried about the county's changing numbers up and down and the potential for ping-ponging between risk levels, especially those in the rural areas. As an example, the city of San Diego has 18,000 cases, the city of Pine Valley, 5. Why do you believe the current approach is the best way forward? And should there be a different approach for areas that aren't as impacted by the virus?
Yeah, I mean, very good question. Something we've long considered. You know, we work very closely at the county-wide level. We have, throughout this entire response, had many counties step forward and highlight exactly what what your statement highlights, that we have differential levels of transmission throughout the different parts of the county. We continue to work with the county to figure out where those trends might be, especially those upward trends where we might intervene. But certainly our approach has been county by county, county-wide. And so we look forward to continuing to work with the San Diego leadership, both on the health and the elected side, to make sure that we do make the right decisions for that county, broadly speaking. And we'll be looking forward to the upcoming week in those conversations so that we do indeed deliver a strategy that makes sense there. We do empathize completely with the concern of the business owners and the idea of opening up just a couple of weeks ago only to close back down. And that's exactly why these conversations are so important between the state and the county leadership.
Mike Lurie, KCRA.
Yes, Dr. Ghaly. Today, the California Fitness Alliance filed a lawsuit against the State Department of Public Health. They are asking the state to open up more gyms and allowing more people to work out. So my question to you, sir, is this. Now that the COVID rates are going down, when will you allow more people to work out in gyms?
Yeah, I'll say two things at the top that I really can't comment on active litigation. So I'll just keep generally the idea that our tiering system really does allow counties, as that transmission comes down, as you pointed out, to increase occupancy, the level of operations in any one of the different sectors, whether it's gyms or restaurants. So you can follow along as a county moves from purple to red to orange to yellow, the increasing nature of those operations. And we're continuing to work with counties as they move through it to see when they decide, and it's appropriate under the state's sort of ultimate guidelines, to be able to not just have gyms consider for increased operations, but other sectors as well.
Mike Duffy, ABC 10.
Hi, Dr. Ghaly. It's kind of a two-part question. Is there any state push to increase availability of rapid coronavirus testing or in-home testing? And we've heard from a number of people that it seems that they're giving themselves permission to travel or attend gatherings if they get tested first. What do you think of that practice?
Yeah, so there is, as we anticipated, and part of the reason why we went out as a state and a few weeks ago now announced a major partnership with a testing company to bring 150,000 tests a day of the PCR tests. Those are not the rapid at-home tests as the ones you mentioned, because that's a true sort of backbone gold standard test that's going to allow us to support the plethora of different testing modalities that we're seeing come across the state. So in specific, the test that is usually most rapid, often done without a major lab running the test, are what they call antigen tests. We're learning more and more about the antigen tests. Not that it's a new modality. We've had antigen testing for many, many other infectious diseases, but these antigen tests need to go through very rigorous understanding of how sensitive that is, how specific the test is, meaning how reliable can we say a positive is really a positive test or a negative test is really a negative test. And we want to make sure as those test options pop up across the state, they continue to get used more and more, that we have that backbone foundation to be able to confirm negatives and positives alike. We believe that antigen testing and sort of this rapid testing really creates an opportunity for the state to, in a multi-modality way, both with antigen testing and PCR testing, potentially come together to allow testing to happen at a broader scale than we could ever imagine with just PCR alone or antigen testing alone. So we are continuing to look at these different test modalities, understanding how we're going to bring them together really in advance of flu season, so that we have a testing strategy across the state that sort of draws on the strengths of both modalities. In terms of people getting tested to have to seek permission to travel, of course, it's good to know in the moment whether you're positive or negative. And again, it depends on the type of test that you're getting tested with to really understand that. But wherever you are, know that whenever you get tested, it just tells you what you are at that moment, not even the day that you get the result. So if you get the result the very next day, it's really, the test result is about when you got tested. And I want to remind people of that, because you may find yourself falsely comfortable that, oh, I was tested 3 days ago, so I'm negative, that gives me a green light to do many things that you would have otherwise not done, especially using the guidelines. So the strongest thing to keep in mind is whatever you're doing, try to keep your mixing low, use your mask, even when visiting a relative you haven't seen for a while. I know the urge to hug and really connect is there. But in this critical time where we've seen so much transmission happen in those environments, that we want to really sort of stick to these signs. Back to the question of what keeps me up at night, certainly it's going to be our ability to sort of keep our guard up as much as possible. And testing is an important tool and knowledge for us, but it's really these tried and trues on how we carry ourselves through our communities that I think will be most important.
Claudia Pechueta, KNX Radio.
Hi, I have a couple of questions. I'm wondering what you think about contact tracing apps. Do you think they're an effective way to supplement traditional contact tracing efforts? And is the state considering using Citizen Safe Pass or something like that? And my second question is, are you seeing any evidence that prolonged exposure to poor air quality is causing more severe illness from COVID? Thank you.
Yeah, two excellent questions. On the first, we have been tracking what they call, you're calling contact tracing apps. Others have called them exposure notification, because they aren't necessarily designed to be contact tracing tools necessarily, although many see these as complementary measures. We think that some of these app-based notification tools can certainly help augment the work of classic contact tracing. But really the tried and true disease investigation first, identifying contacts, calling those contacts, supporting those individuals to understand whether they should quarantine, get tested, isolate, is all part of what we continue to do. We look forward to any technology that helps do that a little faster and swifter and more reliably, but they really do, they are meant in some ways, when applied, to come together and not necessarily to replace that classic public health function of disease investigation and contact tracing. We have long been looking at various apps that have come our way. We're really home to many of the most innovative, thoughtful leaders in this space throughout Silicon Valley and other parts of the state. Work with some of the big companies like Apple and Google to understand their technology. And as we see increasing evidence that the use of these tools does help augment and support our efforts, we will consider applying them. I think some people saw the news in Los Angeles where a citizen app, which already had high uptake, was being launched and promoted there. And we're certainly interested in watching what we can learn in that experience, as well as others, to determine what can happen statewide.
Final question, Ana Ibarra, Cal Matters.
Hi, Dr. Ghaly. I'd like to ask about surveillance or asymptomatic testing of teachers and staff as schools reopen. So it looks like CDPH has deferred that decision to county health officers. The governor said in a July press conference that there is a requirement that school employees are tested on a rotating basis. So I was wondering if you can fill us in on what exactly is the state recommending or requiring, and do you believe schools should be routinely testing employees and students to prevent outbreaks?
Yeah, excellent question. Yes, indeed. In July 17th, exactly when we announced our school guidance, we did talk about some specific recommendations on a frequency of testing, so that staff in some of the lower transmission counties that work in schools in lower transmission counties did get some testing every periodically, and that requirement might increase as transmission increases throughout their communities. We still believe that testing and the results of that testing give us not just a sense of what's happening among the individuals in a school, but in the school community, that might trigger some decisions about specific cohorts in a classroom, or an entire classroom being asked to stay home for up to 2 weeks while the rest of the school operates. And then as part of the conversation around specific school closures, and then ultimately about what a district should do. So we do believe that testing not only gives individuals confidence periodically, but really does give us a sense of how transmission is happening within their communities. We believe that the health officer relationships with schools, which have been very robust historically, much of the partnerships that health officers have with various sectors really do hinge on those relationships with public schools. And so in an ongoing way, the communities and the school districts and the public health officers coming together to determine a level of testing that they want to achieve is what we expect and will probably be seen over the next many weeks. I will remind you that part of the reason why the state pursued the large partnership around testing with Perkins-Elmer, up to 150,000 tests a day, was in order to be able to support school testing in a robust way, so that the availability of testing, whether it's PCR testing or antigen testing, isn't necessarily a rate limiting step to allowing our schools not just to open, but to stay open and with some confidence. So again, I just want to thank you all for the questions and coming together with us on this afternoon. We look forward to seeing you again soon and updating again our tiering a week from today. And so with that, thank you very much and have a good afternoon.